By the time we met Sybil this past spring, even a simple task like eating breakfast was a frustrating battle with her own body.
How can you live your life shaking so much?
It's extremely difficult, sometimes even overwhelming. And I get very emotional, sometimes I cry. It's just a hard thing to do.
The disease had gotten so bad that sometimes her muscles froze completely, making her face almost expressionless, and her legs almost useless. The woman who once was always on the go could barely move, confined to a wheelchair. But as the disease got worse, the drugs did less.
One of the things that this disease has really accomplished is it has really robbed me of my dignity, my self-esteem, because it has taken away my independence. When you have to be totally dependent on other people to do everything for you, you actually lose your self-respect. You feel worthless. And that's what Parkinson's has done for me.
But on the morning of the surgery, Sybil was confident, even as nurses fitted her with a head frame to help guide surgeons during the operation. Deep brain stimulation comes down to one thing: location. To help pinpoint the region of Sybil's brain where he would be working, neurosurgeon Roy McKay used magnetic resonance imaging. Since Sybil's symptoms were worse on the right side, doctors would implant the left side of her brain, which controls the right side of her body. And the doctors prepared to drill a hole into her skull for the electrode. That's what they will use to discover the exact dimensions of the location in her brain that's malfunctioning. Finding the target area holds the key to Sybil's future. Dr. Piquet and Dr. Vitek used the electrode to map Sybil's brain. The device electronically records the activity of individual cells within her brain, so the doctors can actually hear the trouble spot. That noise is the sound of a neuron misfiring.
Can you move your ankle up and down? It's hard to do for her.
Finally, the doctors think they have placed the electrode in the exact location that will help Sybil. When they turn on the stimulator, she suddenly shows an astonishing range of motion in her legs and hand.
Take the leg up at all? There you go. Up and down. Drop it down now. Now pick it up. Great. Well, she couldn't do that before. How about the hand? Can you open and close your hand for me now? Good.
All those benefits on the right side of Sybil's body were from the pulse generator stimulating the left side of her brain. When Dr. Marian Evan turned the stimulation off with a magnet, as she did here for a routine test, the tremor returned to Sybil's right hand almost instantly. She was doing so well that Dr. Vitek had a surprising suggestion: more surgery. He thought that a second implant in the right side of Sybil's brain could get rid of the tremor in her left hand and might improve her stride.
The minute they got in, Andy hit the target. It's like magic.
Okay, open and close your hand.
He said to me, open your hand and close your hand. So I knew right away. It's amazing.
Sybil now had two stimulators, one for each side of her body.
How do you feel?
Great.
What can you do now?
Oh, good.
She is amazing. She says, I have my dignity back and I'm taking hold of it. And that takes a lot of courage for somebody to have brain surgery like this, to have a wire put into your head, to think it's going to control your Parkinson's symptoms. Really incredible. I have so much admiration for her, and I'm glad that I had the opportunity to get to know her. But now I want to show you a series of pictures where informed consent was not adequate. Now, this was a study that was presented in the New England Journal of Medicine. And this is a woman who had deep brain stimulation. She had the electrodes in her brain, and, you know, with the monitor on her chest. But the doctors, you know, I mentioned about the electrode had to be right in the right place. And in her case, they knew that when the electrode was between the second and the third node, that the everything would be fine. But for some reason, the doctors decided to switch the connection to stimulate between the first and the second leads. This was a totally unplanned experiment. And the distance between the leads is so minuscule, you can barely see it with the naked eye. So here are pictures of the experiment that was taken. And it didn't take that many minutes. The woman starts out, she's alert, and then as soon as the electrode is switched, within 30 seconds she becomes very pensive, that's in the B screen, and within 4 minutes she becomes very sad, tearful, actually suicidal. She said she could not go on with the disease and the doctors should end her life right then and there. Well, the doctors quickly switched the leads back to the second and third lead, and within 5 minutes she recovered, and in fact she became absolutely euphoric, as you can see in picture D. So I ask you, what kind of informed consent is appropriate here? Nobody knew exactly what was going to happen, and in fact, it was very lucky that they were able to bring her back to her normal state, because we know about the plasticity of the human brain, and it's conceivable that they could have damaged something and left her in this absolutely depressed state. So this was amazing. But I don't want you to be negative about this, because you know what? It really raised a question in people's minds. Is there a depression center? Is there a place in the brain where you could place an electrode and it would actually cause depression? Or maybe if you stimulated that area, it could actually relieve depression? Well, in fact, I'm happy to report that Dr. Helen Maybury, who's now working at Emory University in Atlanta, is implanting electrodes in the brains of people who have intractable depression. These are people who have tried everything, every medication known for depression, electroshock therapy, everything, nothing has worked, and she's implanting electrodes in their brains in a particular center, and lo and behold, these people's symptoms of depression are relieved. Now, nobody knows why. Why should stimulating a part of your brain relieve depression? I'm hopeful maybe one of you, sometime in the future, will find the answer. Here's another pioneering person. Anybody know who this person is? I can't hear. Shout it out. No? Okay, this is Sir Christian Bernard. Anybody recognize that name? What did he do? He did the first heart transplant in South Africa. First heart transplant. Now think how he must have felt taking a heart out of somebody and implanting it into somebody else and seeing the heart start beating again. I mean, really, how dramatic is that? And now we're doing heart transplants as often as we can find a donor. There's always somebody who needs a heart to be saved from really dreadful heart disease. Well, we are definitely in the most exciting era, I think, now of technological breakthroughs. And many of these breakthroughs are terrific, but many are still very contentious. And one that needs a great deal of informed consent and education, especially directed toward Congress, is stem cell research and cloning.